Hey friends, welcome to Nursing Online Education. In this video, we will be discussing important question and answers of different nursing comparative examinations. Guys, let's get started. Here is our first question.
1. Patient with gout is encouraged to increase fluid intake. What is the benefit of the fluids? A. Decrease inflammation. B. Increase calcium absorption. C. Promote excretion of uric acid. D. Provide a cushion for weakened bones. The answer is option C. Promote excretion of uric acid. 2. During preoperative preparation of a patient for amputation of the left leg, what is the nurse's primary responsibility for? Witnessing the patient's signature on the consent form. B. Explaining the procedure to the patient. C. Explaining the risks of surgery to the patient. D. Marking approximate incision lines on the leg. The answer is witnessing the patient's signature on the consent form. 3. A patient is scheduled for a bowel resection. The preoperative plan of care includes putting on antiembolism stockings prior to the transferring the patient to the operating room. What these stockings will do? A. Promote venous return. B. Minimize joint stiffness. C. Encourage sustained maximum inspiration. D. Support intestinal peristalsis. The answer is option A. Promote venous return. 4. A 5-year-old child is admitted to the hospital for heart surgery to repair the tetralogy of Fallot. The nurse reviews the child's record and notes that the child has clubbed fingers. This finding is indicative of which condition? A. Tissue hypoxia. B. Chronic hypertension. C. Delayed physical growth. D. Destruction of bone marrow. The answer is option A. Tissue hypoxia. 5. A client with angina complains that the anginal pain is prolonged and severe and occurs at the same time each day, most often at rest in the absence of precipitating factors. How would the nurse best describe this type of anginal pain? Stable angina. B. Variant angina. C. Unstable angina. D. Non-anginal pain. The answer is option B. Variant angina. 6. The home care nurse observed that the asthmatic patient has a cough, wheezing. The nurse administers an albuterol, Prevental, nebulizer treatment as ordered. Which type of implementation is this? A. Discharge planning. B. Instruct. C. Monitoring and surveillance. D. Therapeutic intervention. The answer is option D. Therapeutic intervention. 7. The nurse sustains a needle stick injury after administering an intramuscular injection to a patient. It is recommended that the nurse be tested for human immunodeficiency virus, HIV, immediately with repeat test in 6 weeks. B. If the patient refuses HIV testing. C. If the patient has symptoms of HIV infection. D. A month after taking prophylactic antiviral. The answer is option A. Immediately with repeat test in 6 weeks. 8. A patient with a dissecting aortic aneurysm is prepared for surgery. The nurse must review the patient's records for results of which of the following? A. HIV-1 testing. B. Stat blood work, type and cross-match, C. Urinalysis, D. Echocardiogram. The answer is option B. Stat blood work, type and cross-match. 9. ACO worker informs that the nurse about experiencing increased level of stress associated with daily responsibilities. To help cope with professional stress, the nurse should encourage the coworker to A. Make a list of unfinished tasks, B. Complete complex mental task before physical tasks, C. Acknowledge daily accomplishment, D. Spend time with colleague away from work. The answer is option B. Complete complex mental task before physical tasks. 10. 31. A school nurse refers a child who failed the school vision screening for eye doctor. The child returns with glasses to be worn at all times. The nurse should monitor this child for lazy eye, B. Improved vision with glasses, C. Redness of the eye, D. Episodes of seizures. The answer is option B. Improved vision with glasses. 11. Patient who is prepared for hip surgery has an order for external pneumatic compression devices. The nurse teaches the patient that pneumatic compression can help prevent bleeding at the surgical site, B. Deep vein thrombosis, C. Upper respiratory infection, D. Decreased breath sound. The answer is option B. Deep vein thrombosis. 12. The nurse is teaching the parent of a child with celiac disease which of the following diets should be reviewed with the parent: gluten-free, B. Dairy-free, C. Vegetarian, D. Sodium-restricted. The answer is option A. Gluten-free. 13. A nurse on the oncology unit is planning care for several children who are terminally ill. Which of the following should be included in the plan of care of a child who practiced Catholicism? A. Notifying the crematory, B. Discussing reincarnation, C. Closing the eyes as death approaches, D. Offering sacrament of the sick. The answer is option D. Offering sacrament of the sick. 14. A patient is scheduled for an abdominal aneurysm repair. This is what type of surgical intervention? Diagnostic, B. Transplant, C. Curative, D. Palliative. The answer is option C. Curative. 15. Which of the following can be used to determine if a prescribed pain management therapy is effective for a nonverbal patient? A. APGAR assessment tool, B. Barden scale, C. FACES rating scale, D. Papanicolaou test. The answer is option C. FACES rating scale. 16. While performing cardiopulmonary resuscitation on a 5-year-old child, the nurse palpates for a pulse. Which of the following sites is best for checking the pulse during CPR in a 5-year-old child? Femoral artery, B. Carotid artery, C. Radial artery, D. Brachial artery. The answer is option D, brachial artery. 17. An infant arrives in the emergency department not breathing, does have a pulse when starting cardiopulmonary resuscitation. Where is the correct place to assess for a pulse in this patient? A. Radial, B. brachial, C. carotid, D. femoral. The answer is option B, brachial. 18. A nurse is caring for an infant with respiratory distress syndrome. Which of the following nursing intervention is appropriate? A. Measure oxygen saturation level once a shift. B. Monitor for symptoms of hyperglycemia. C. Maintain infant temperature between 36.70–37.80 C. 970–980 F. D. Monitor hydration status. The answer is option D, monitor hydration status. 19. The client diagnosed with an exacerbation of COPD is in respiratory distress. Which intervention should the nurse implement first? A. Place the client in the orthopneic position. B. Administer 6L oxygen via nasal cannula. C. Assess the client's pulse oximeter reading. D. Notify the respiratory therapist. The answer is place the client in the orthopneic position. 20. The nurse assesses the client's peripheral intravenous sight and notes that it is cool, pale, swollen, and not infusing. Which condition should the nurse document? A. Phlebitis, B. Infection, C. Infiltration, D. Thrombosis. The answer is option C, infiltration. 21. After having an IV line in place for 72 hours, a patient complains of tenderness, burning, and swelling. Assessment of the force site reveals that it is warm and erythematous. This usually indicate phlebitis, B. Infection, C. Infiltration, D. Thrombosis. The answer is option A, phlebitis. 22. A 68-year-old client on day 2 after hip surgery has no cardiac history but reports having chest heaviness. The first nursing action should be to A. Inquire about the onset, duration, severity, and precipitating factors of the heaviness. B. Administer oxygen via nasal cannula. C. Offer pain medication for the chest heaviness. D. Inform the physician of the chest heaviness. The answer is option A. Inquire about the onset, duration, severity, and precipitating factors of the heaviness. 23. Which of the following explains the term pulse pressure? A. Is the capacity of pulse. B. A relaxation of the ventricle. C. Is the maximum ventricular contraction. D. The difference between systolic and diastolic blood pressure. The answer is option D. The difference between systolic and diastolic blood pressure. A patient presents to the office for a physical. The patient is found to be healthy and fit but occasionally drinks alcohol and has unprotected sex. What is the best nursing diagnosis? A. Health-seeking behavior. B. Knowledge deficit, high-risk behaviors. C. Low self-esteem. D. Altered thought process. The answer is option B, knowledge deficit, high-risk behaviors. 25. What is the type of information that the nurse collects from her observation of the patient called A. Subjective, B. Cultural, C. Objective, D. Familial? The answer is option C, objective. 26. A patient has an order for 1,000 milliliters, ml, of intravenous, IVF, fluid to infuse over 8 hours. The available 4 tubing has a drip factor of 10 GTTS/milliliter. Which of the following rates is correct? A. 125 milliliters per hour. B. 125 drops/minute. C. 21 drops/minute. D. 21 milliliters per hour. The answer is option C, 21 drops/minute. A patient with a dissecting aortic aneurysm is prepared for surgery. The nurse must review the patient's records for results of which of the following? A. HIV-1 testing. B. Stat blood work, type and cross-match. C. Urinalysis. D. Echocardiogram. The answer is option B, stat blood work, type and cross-match. 28. A patient presents to the clinic with complaints of urinary incontinence. The nurse performs an assessment to identify reversible causes for the incontinence. Which of the following patient medications would the nurse most likely consider as a possible contributing factor or cause? A. Antidiabetics. B. Antibiotics. C. Antivirals. D. Anticholinergics. The answer is option D, anticholinergics. 29. Which of the following explains the term pulse pressure? A. Is the capacity of pulse. B. A relaxation of the ventricle. C. Is the maximum ventricular contraction. D. The difference between systolic and diastolic blood pressure. The answer is option D, the difference between systolic and diastolic blood pressure. 30. A 55-year-old man takes cyclosporins mg by mouth twice per day that he had a heart transplant 2 months ago. He complains of stomach cramping, diarrhea and muscle twitches. Which electrolyte is most likely elevated? A. Calcium. B. Sodium. C. Magnesium. D. Potassium. The answer is option D, potassium. 31. A patient is attending a primary health clinic for regular checkup. He complains of constipation. After assessment, the nurse instructed him to consume bulk-forming foods. Which of the following are the best bulk-forming foods? A. Fruit juice. B. Raw meat. C. Whole grains. D. Milk products. The answer is option C, whole grains. 32. Which of the following is considered laxative-producing foods? Cheese, pasta and eggs. B. Bran, figs and leaf green. C. Rice, eggs and lean meat. D. Cabbage, onions and cauliflower. The answer is option B, bran, figs and leaf green. 33. Which of the following is the most common site to obtain a capillary blood sample from neonates? A. Earlobe, B. Fingertip, C. Heel, D. Abdomen. The answer is option C. Heel. 34. A 5-year-old child is brought into the emergency department complaining of pain in the right hip area. The patient is not able to bear weight on the right leg. Which pain scale should the nurse use for this patient? A. Faces pain rating scale, B. Verbal rating scale, C. Numeric rating scale, D. Pain rating diary. The answer is option Faces pain rating scale. 35. A patient is seen in the emergency department with complaints of angina. Nitroglycerin is ordered by the physician. This medication is to be administered via which of the following routes? A. Intradermal, B. Buccal, C. Parenteral, D. Topical. The answer is option B. Buccal.
Thank you for watching.